knocking on patient door, patient privacy, and hygiene. Hi, how are you? My name is Vivian. I'll be your nurse today. Can I get your full name and date of birth?
Was this one yours or theirs?
Okay. And do you know where you are today? And how you got here? And what's the date?
No, mine is my bag.
Okay, sounds good. So today I'll be performing some ostomy care for your stoma. And then I'll also be cleaning it, and then I'll be providing you with a new stoma bag. Is that okay with you?
Whatever.
Do you have any allergies that I should know about? And what would you say your pain is right now from a 0 to 10? Okay, sounds good. So I'm just gonna lower the head of the bed really quick into.
Let me see if I can memorize it right here.
Okay, we're gonna raise the bed a little bit up to a little height. And then lower the head of the bed to semi-reclining / supine position. Okay, I'm just gonna perform hand hygiene. Apply some gloves. So I'm just gonna make sure to place down this barrier in case anything leaks.
Like, that's CNN. That's crazy. I don't think she's gonna. Why would she get everybody confused? I know, right? That's what I remember.
And then I'm gonna place this biohazard bag right here. So when assessing your incision site, I'm gonna look for any skin irritation. I'm gonna look for any redness, any swelling, any bleeding, and then I'm gonna also make sure to record your eyes and nose. Just gonna drain your bag into this urinal. Good. And I'm gonna make sure to measure it at eye level. And so when taking off the bag, I'm going to make sure to go alongside the patient's direction of hair growth. So I'm going to place one hand down and take off the bag slowly, making sure to ask the patient how they're feeling. I'm going to dispose of the bag. And then I'm just going to assess the location of the stoma. I'm going to assess for any redness, irritation, swelling. I'm going to ask how the patient's pain is. And then I have this warm washcloth over here. And this is just with some warm water. I'm going to make sure to clean the patient's incision, around the incision site. So we're going to clean, fold, clean, fold, and fold. Okay, good. And then I'm going to use an alcohol prep pad to clean around the patient's stoma.
And then the stoma, like the appearance of the stoma, the size, the location of it.
And then
check the condition of the person's skin.
now that I have cleaned around the area and I've assessed it, I'm going to be using this ruler to measure the patient's stoma area.
I think you could tell that I'm reading it.
And making sure to not touch the area in case of any bleeding. Okay, good. And then this is the new stoma that I'm going to be using. So I'm going to make sure to get this ruler. And then I'm going to make sure to assess that I'm getting the correct measurement. And then once I get the measurement down, I'm going to be getting a pair of scissors and cutting around to get the correct shape. Good. Disposing of these gloves and hygiene. And I'm also going to be assessing for if there's any sutures or incisions around the area site.
And then finally, I would also document patient teaching.
This camera work is crazy, bro. It can is.
Okay, so now that I've cleaned the area, I'm just going to be grabbing the new stoma bag as well as a clamp, and then this is already measured. So I'm going to be attaching the new stoma bag together. And then I'm going to be peeling the adhesive.
How did I do this before?
Did the one that's due tomorrow?
Or did I screen record something and then
To stick.
do you remember? I remember.
And then I'm going to be making sure to clamp the bag together.
But I hope I don't have to do a bunch of variations. I think the next one for the med surgery is musculoskeletal. Hopefully I get rid of it. That was the gash. I took the test for that, but I haven't finished the tool. I spent so much time on the voice.
Clamping the bag.
I spent so much time on the void care.
They have that underneath.
Dude, low-key, I feel like I wrote because it said 6 pages. I think mine was.
So now that the bag is clamped,
Yeah, low-key, that's like my
Yeah, mine was 9 pages.
I'm going to ask the patient how they feel. Maybe
I
disposing.
just wrote this stuff. Did you write something?
Before I dispose of these gloves, I'm going to make sure to clean up my work area.
It's just
This side. And then I'm going to ask how the patient feels, and then I'm also going to be assessing the location of where I put the stoma bag, the size of it, the length, the type of bag that I used, how the patient tolerated it, as well as the appearance of the wound, how much I record the eyes and nose, and then I'm gonna describe what the drainage was, as well as if there was any sutures or any bleeding involved. How are you feeling? How is your pain now?
no, there's like a box.
Okay guys, that was it. I'm gonna be disposing of my gloves. And then bring the patient back up. And then make sure to get you back into the position again. I'm gonna be lowering the bed.
Did she comment on your
Okay, so I'm gonna go document my findings. Please let me know if you have any questions. I'm gonna leave your call light right over here. And thank you. Hand